Hi, everyone. On today's podcast, we're going to talk with Brooklynn and Hoang Pham about their powerful and miraculous hospital birth story. Welcome to the Evidence Based Birth Podcast. My name is Rebecca Decker, and I'm a nurse with my PhD and the founder of Evidence Based Birth. Join me each week as we work together to get evidence-based information into the hands of families and professionals around the world. As a reminder, this information is not medical advice. See evbirth.com/disclaimer for more details. Welcome everyone to this week's podcast episode of Evidence Based Birth. Just a quick content warning before I begin. In this episode, we will be talking about maternal mortality and racism. And now I'd like to introduce our honored guests. Today, I'm so excited to welcome Brooklynn and Hoang to the Evidence Based Birth Podcast. Brooklynn and Hoang Pham currently live in Davis, California, and are the parents to Marvel, who turns 7 months last December. Brooklynn is the Senior Managing Director of Teach for America in Sacramento, and Hoang is finishing up his final year of law school at UC Davis School of Law. They took the Evidence Based Birth Childbirth class with EBB instructor Shalin Butterworth and are here to share their birth story, which they told me was powerful and miraculous. So I can't wait to hear how everything went. Welcome, Hoang and Brooklynn, to the Evidence Based Birth Podcast.
Thank you so much, Rebecca. Thanks for having us.
We're excited to be here.
So tell me, how did you find out about the Evidence-Based Birth Childbirth class? How did you get introduced to EBB?
So we have Midwives that we had been routinely seeing at Sutter Davis, and we were just inquiring about different opportunities to learn more about the experience and ways to just prepare us for having our first baby. And one of our midwives, Jen, mentioned evidence-based birth instructors and classes, and sent us a link to a few different resources. And so we were able to contact those resources and got in contact with Shalin Butterworth, and who became our evidence-based birth instructor. And we started going to classes with her.
And this was a first child for both of you, correct? So What were your thoughts and feelings going into educating yourself? How are you feeling about meeting your baby and going through childbirth and everything before you took the class?
Gosh, I think the first class she asked a question around what are your experiences or what are your thoughts about even labor? And the first word that came to mind for me with every question was pain. Pain, 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 pain. That's what I was preparing myself for. And so that's what I initially thought the birthing experience would be, just a lot of pain, just a lot of just exhaustion and pain. And so I had only been thinking about that. I wasn't even really thinking about the 10 months leading up to having the baby. I was just thinking about the actual labor. So my associations were really negative, I would say.
What about you, Hoang?
Yeah, I'm trying to think back to what I was thinking, and I remember just being very ill-informed, just not knowing anything. All of my experiences with understanding what labor was from television. So the car ride to the hospital,
rushing to get there in time.
Yeah. the 5 seconds that it takes for the baby to come out, the yelling and the loudness. That was what I was thinking about. Now, I wanted to know more about, okay, what is this actually like, and what can I do as a partner to help support my wife in going through this experience? And I remember even on that first class that we went to with Shalin, that Shalin did a really good job of just including everybody that was there, all the partners that was there. We all had a role in understanding what the labor experience is all the different stages of labor, and the things that we could do to help support our partners in having a good and positive experience with birth. So I thought that was and this is before Shalin became our doula. This is just the first class that we had with her for our EBB class. And I think that first kind of impression that we had with her was just this warm, welcoming experience that everyone had a part to play in supporting the birthing person. And I really loved that. Obviously, a lot of that information that I learned on that first day, it's information that I just did not know at all from anywhere else, because most people growing up in America, like I said, your experience with birth, if you never had gone through it or have gone through it with somebody else, is primarily from media. Mm-hmm. And so for me, it was just okay, this is just supposed to happen. We're supposed to rush to the hospital at some point. I was supposed to drive fast in a car. And by the time we get there, you just have the baby, and the baby cries, and we move on, right?
Just like the movies. It really is amazing how little awareness like most people have, or like education about just a basic bodily function of birth and labor and everything. And I've met a lot of people when I teach college classes who are just like, why weren't we taught this in high school even? Like, this just seems like basic information that we should all know about how human bodies work.
Yes.
So,
Yeah.
yes. So what was your experience like taking the class? You said you got to the first live session and you had just learned stages of labor, and then you went through the next, 5 or 6 weeks together. What was that experience like?
Gosh, it was so empowering. I felt like with every session, I was feeling more connected to my baby, to my body, and to Hoang as my partner, like in preparing for this. Just because I went into it thinking that like it was also all on me, and I had to do things to like get my brain, my body, my spirit like ready. But it was like so much more about like our partnership and the role that that he and I both play in getting our baby here. And so with every session, I just felt more empowered. I felt like it was a space where I was finding my voice and finding like my unique like value add in this world. I know that seems like real deep, but like that's what the experience was for me. And yeah, by the end of the sessions that we had, I felt ready. Like I felt like a different person, just ready to be a mom, and yeah, ready to go into labor and like have our baby.
And you weren't as terrified anymore of the experience?
No, I was like, I had Marvel at 42 weeks and a day. And
Wow.
So by that time I was really ready. I was like, gosh.
This can't happen soon enough.
Yeah. But I wasn't scared anymore. I was more like eager and excited.
Okay, wow. Well, we'll have to hear about that 42 weeks in a little bit. What about you, Hoang? What was your experience like?
I felt the same. I think for me, I learned about a lot of things that I could do. And I thought that was really empowering. So like Brooklyn, and using the word empowering, I think that really describes what the EBB class was like for us. Mm-hmm. I learned about acupressure points that I had no idea like at all that these points even existed, and who knew that like you could stimulate labor by pushing on these points. So don't do it before like 36 weeks. I don't remember what the number exact weeks were, but like don't do that, right? Like, I was just like, okay, that's really cool, but like who knew that like there's these things about our body that works in very peculiar and really cool ways that you could actually help with natural like labor. Like you can help induce labor by using these points. You can help. There's certain things you can do with your body that would help position the baby in a more
optimal position. Yeah.
Yes, that was a good word for that. Yeah, like so I think knowing those things was really helpful for me, because then I could decide, okay, well, how can I help Brooklyn when she actually is in labor? And I think in going through the class, like you kind of get those ideas cemented in your mind that like this is doable. Like it's like, and it's like a long journey, but it's a doable one, because you have all these resources and tools that will help you as you go through that journey. So even before we I think the class maybe was due at the end of April. Due date was like April 30th, and we ended the class in like March, right? So there was like almost like a month and a half between the time the class ended and the time that the baby was actually due. And I remember thinking like, okay, yeah, like this is awesome information. And then like it kind of slowly faded away, right, after a couple weeks of the class being over. And then like once things started speeding up again, like we're like, okay, it's like week 40 or like week 39 or 38. I was like, had questions about what to do or what we could do. And what did we do? We opened up our EBB book and started reading again, going back to the information. I thought that was really, really helpful to have that as a resource, just to know what is going on right now with her body. Like, what should we be thinking about? What could we be doing? What do we need to be considering, especially like if these things are like happening? And I think every time that we had a question, even when we met with our midwives on a weekly basis, we could go back and reference some evidence that would support some decisions that we want to make. Whether it was, getting a vaginal exam or not, or other things that they would recommend for her to do. So it's really helpful to go back to that information. And I think one thing we told Shalin, I think is a sentiment that we both share, is that EBB like the class itself was an investment for us as a couple. Now that we have this information, like we store our information in a special place where next baby comes, we'll have it all right there. But like now that we have this information, it's like you'll always be empowered to know, what this process is like and to have a good birthing experience, which is something that I know that Brooklyn wanted. So, and I wanted too.
And we recommended it too to so many other like friends and family members because of how valuable it was for us. We felt like we had a responsibility to share the information with others.
Oh, that makes me so happy. Thank you for spreading the word with your friends and family.
Thank you for doing this.
Right. Thank you for putting this together.
This is a side, but like, I'll be honest, like we had no idea what to do. Like, this is December. It was like week 20 or something of the being pregnant. And we're just like, are we like late for like classes? Like, do we need to like start figuring out what to do? Because we just had no idea. I mean, all the information we got was from the hospital, right? So that was the extent of what we knew to do. And our midwife was like, you should definitely take a birthing class. There's one that's offered through the hospital, and then there's like others like Evidence Based Birth. And we're like, let's check out Evidence Based Birth and see what that's all about. And like, I think just the availability of what you give and provide in information for mothers and dads just to go through this experience together is so valuable. And like Brooklyn said, it's very empowering because, again, most of us don't know any of this information, and this is our first time going through this experience.
It's interesting that you called it an investment because I was thinking about it's just like it's both with education and with doula support are two things that will go on if you have more children to affect your future births because you have this education you can continue to like go back to this information. Yep. But then also having a doula, some people were like, well, a doula, I pay for a doula, it's just for that one birth. It doesn't help with my other births. But it actually does because if the doula can lower your risks of certain things happening in your first birth, and that goes on to make your subsequent births less complicated too, if that makes sense.
Absolutely.
Yeah.
Absolutely. That's what we were really thinking. Like, this is an investment not just for this baby, but like for our family, like our future family, for kids to come.
Yeah.
I'm going to share just one more story just before we move on to the next part.
Okay.
Because I think we're moving into like, the next part would be like, what was your birthing experience? Like, what was the actual birthing experience like? So before that, like in February, my law school, like the Women's Law Association hosted a doctor who came in and talked about birthing rates for Black and Indigenous mothers in the United States. And the one thing, so I was sitting in there, this is like after like the first session with Shalin in the EBB class. I was sitting in that lunchtime session, the talk with the doctor, thinking like, it's 50 minutes long. The whole time you have 10 minutes at the end to ask questions. And the whole time there was never a mention of doulas or midwives the whole time.
And they were talking about poor outcomes, bad outcomes for Black and Indigenous mothers, but not mentioning midwives or doulas as a solution.
Yes, not mentioning them as a solution. And so I was sitting in the back, like, I think I have some information I want to share. And I'm like one of the few, like, I'm like one of the only men in the room, and also one of the only men that asked a question, which was, and so I asked this question. I was like, so, what do you think about doulas and midwives and their role in improving outcomes for Black and Indigenous mothers? And the doctor was like, yeah, they're both really important. I don't remember what else she said, but I remember her like not really answering the question, like not really discussing what midwives and doulas actually do. So she kind of didn't really respond to my question. Other people then started following up and asking more about midwives and doulas. But I found that really interesting to think about, like, okay, like I'm in this space, right, this educational space, this institution that is bringing, doctors who come in and talk about these disparate outcomes for Black and Indigenous women. And yet, like, there's these solutions that have been proven to improve outcomes for Black and Indigenous women, but yet they're not discussed about. Mm-hmm. And then, like, I remember at the end when I was walking out, some of the organizers went up to her afterwards, like, oh yeah, like, I don't want you to feel like Hoang was like, pushing you to think differently about, what we need to do to improve these outcomes. It's just, just want to let you know his wife is pregnant and she's having a baby. And I just thought it was funny because I was like, if I hadn't started thinking about, births in the way that the EBB class made me start thinking about it, I would have not even like asked those questions about midwives and doulas as options. Because I do think, like, I think you make this point in your videos, but also I know Shalin does as well when she was working with us, that like midwives and doulas tend to be like this, there seems to be a hierarchy in the medical field when it comes to knowledge, right? And it seems to start with medical doctors, MDs, and then it kind of goes down from there. And if you don't hold certain degrees, your opinion is, somewhat less valued. And
it's
then
marginalized. You don't have as much power or authority.
Right. And in California, midwives still have to get, I think the law states that like midwives, decision-wise, they still have to get confirmation from an MD to make decisions in the hospital. So it's just interesting to think about, like, when we start thinking about change, when we start thinking about the way that we frame narratives around birthing, how do we change those narratives around, what actually supports healthy outcomes for mothers? Anyways, sorry.
No, I'm so proud of you, Hoang, for speaking up and just like using your voice in that setting. And I think it's cool. It just shows you even just like a little bit of education, like one class session, and you already felt like, I know more than this doctor does actually about solutions. And if you hadn't had that class, like having a wife who's Black and pregnant and you're sitting there just listening to these horrifying statistics, that could have been really disempowering and scary if you didn't know that there are actually solutions for this problem.
Yes.
Yeah.
I think that's one of the things I started feeling was like, all right, you're telling me that Black moms die at a higher rate than any other moms when going through like labor. Like that makes me scared because I don't want my wife to die. And I think like even a couple of days before that, there was a story that I read in an article about his dad in LA at Cedars-Sinai Hospital, and his wife died in childbirth, black family. And like, for me, it was like, it's more than just like knowing this information, but it's also about saving making sure my wife lives. Right. Mm-hmm. And so, yeah, it was scary,
it's
but
extremely personal for you.
Yeah. Yeah. And I think like those questions that I asked, I think I was really just wanting to know, like, what else can we do outside of just knowing like what causes death? Like, what are the preventative steps that we can take? Like, what are the things that we know that can help with creating a better experience for our laboring mothers? Mm-hmm. And so the EBB class helped me like with that information, and then it pushed me to think about like, okay, I know this is not all the information that's out there. Like, you haven't even said midwife or doula yet, and
we spent an hour together and like two of the proven solutions you haven't mentioned. And I just love how you spoke up, because I'm sure everybody else was like, yeah, he's right. Like, why aren't we talking about solutions that are affordable and pretty easy to administer? So tell me about the end of your pregnancy. Like, what kind of birth were you planning? It sounds like you hired Shalin to also be your doula. And was this during the start of the pandemic, or like had everything locked down in California? What was going on?
Yeah, so as we were nearing the end of my pregnancy, we already hired Shalin as our doula, and the world locked down. And so we were thinking, like, what's going to happen if Shalin cannot go into the hospital with us? Like, what then do we do? And so we started just having a plan B of like what to do if just Hoang and I, or maybe even just me, we didn't know, would be in the room by myself. And so Shalin, an additional session with us to practice some of the comfort measures and some of the things that we can try in the event that she was not there, and that Hoang would be like needing to hold it down in the room without her. And we also talked about the option of having her FaceTime in during labor, so that she can kind of like coach and be like a champion for Hoang as he in the room just with me. But yeah, we had no idea what to expect. We were just kind of like playing it by ear and experimenting with different like options. The option of her being there, not being there, FaceTiming in, not FaceTiming in, me being by myself. In some hospital settings at that time, just the woman was by herself in labor. So we were kind of preparing for all of those cases. But because of our class, we wrote a letter to the hospital and basically asked or demanded that our doula be considered a practitioner and be in the room with us. And that was not granted. However, like, we did get a call from the hospital asking, like, what are the ways that we can like support you in preparing for this? Like, what do you need from us to do? Like, what supports was your doula going to provide that we can also think about providing, like, be it lighting, be it like massage, be it like different things, what techniques can we use, which was also very empowering to get a phone call from a hospital asking like, what can we do a couple weeks out away from you being here. And I don't think we would have written that letter if we didn't have like that course that you taught about like advocacy and just the important role we play in making sure that our needs are taken care of. But yeah, so we were preparing for all different kinds of scenarios, baby entering into the world. Yeah.
And what was your birth plan like, other than having a doula? What were you hoping for your birth?
Yeah, I wanted unmedicated birth, and I wanted to be able to have my baby in any position that felt comfortable in the moment. I did not want, what were some other things I put in my plan? I felt like it was so extensive.
There was, because, yeah, there's like
and then it became really simple.
The vaccinations after the baby comes out.
Yes.
Like we didn't want any vaccinations. I think we were like okay with like the vitamin K, but no hepatitis B, I think. And then we wanted the baby not to be wiped down, like to keep the stuff.
So you had a baby plan too, as well as a birth plan. You kind of created a baby plan.
Yeah, I guess that's going into the baby plan now. But
but it all kind of goes together because it's all happening around the same time.
Yeah.
So you were hoping unmedicated in the hospital, and you were hoping that your doula could help you with that.
Also, like there was an option for being in a tub, like a water birth, and I think with COVID they said you couldn't have a water birth anymore, but you could still get in the tub.
Yeah.
So you were hoping to utilize the tub while you were in labor.
Yeah.
So
you could leave the tub, but you couldn't have your baby in there.
Yeah. Okay. So tell us about, as you approached your due date and then went past it, like what happened then?
Got a lot of phone calls and text messages.
From family?
Yeah.
Yes.
A lot.
Everybody wanted to know what was wrong.
Yeah.
Like, what is going on? Something must be wrong because your due date has passed and baby's not here. And that freaked me out. But
I was also taking finals at that time. Those finals came for me. So
there's a lot going on. But so we had a checkup, I think, at 41 weeks and then at 42 weeks. And so 41-week appointment came and baby was fine. And at that point, at the hospital that we're at, we then returned back to the OB/GYN instead of our midwife, because the OB, I think after 40 weeks, I think they bring back the doctor because it seems like a unique case or something. I didn't quite understand. But even though it's normal for your first baby to be born after 40 weeks. And so I saw the doctor again, which I had not seen since being told that I was pregnant, since being confirmed that I was pregnant 40 weeks before, or however many weeks before. And so she said, everything's fine. So she checked fluids, made sure baby had enough like room and fluids in there. And it was confirmed that everything was fine, still considered like a normal pregnancy. And I was sent home and another appointment was made to return in a week. At that point, the doctor asked if she could do a cervical exam, and I declined. And she then recommended that I get one when I return if baby's not here in another week. And so that's what we did. I went back at 42 weeks. Baby still had like great heart rate, plenty of room. I was just real comfortable, I guess. And at that point, they recommended that I be induced because it was at 42 weeks. So I did have a cervical exam then and was 3 centimeters dilated. And they said that they would give it like another day, but then come back in the next day, essentially. So they were like, baby is coming. But yeah, so baby didn't come the next day. And that's when I was induced with Pitocin.
Okay, so you showed up at the hospital. Was it early in the morning for an induction, or what happened?
I showed up
like around 2 in the afternoon.
Oh, in the afternoon? Okay.
Yeah.
And our doula was still recommending, because I told her that, like, I still wanted to, like, an induction was what I wanted to avoid. I wanted to try some other natural methods first. And so I breast pumped for, maybe an hour or so to see if my contractions would start from the pumping. I think I did like some exercises.
We did like everything that you could possibly try to do.
I even took misoprostol, I think.
Misoprostol.
From your provider?
Mm-hmm.
Yeah.
Okay.
Yes. To see if
that would just start things.
Yeah.
It wouldn't start. And so the last resort was
Pitocin.
Started Pitocin around, I think, midnight. So we had been there for a good, 10 hours?
Yeah.
Wow. 10 hours. And then
It was,
started the induction at that time.
Do you remember everything after that?
I do.
So what happened next?
Well, there was a couple things that I remember that I don't know if she brought up. Like, it was, so we stopped breast pumping at 10. We decided on Pitocin around that time. At 10:30, they came in there. They said, okay, we have to start an IV so we can start the Pitocin. They come back in at 11, and they try to insert the IV, but they couldn't get it in any of her veins. So they poked her like 6 or 7 times, which is really, really hard. It was like an hour of just poking. I remember just sitting there like, I want this to end. Like, I wanted the baby to come out. I don't want her to get poked anymore.
This was not the plan.
I want the baby to come out. So they finally like inserted the IV in the probably least optimal place, which is like in the eye of her elbow, which is really hard for her to move. But that was just the only place that they could like insert an IV. So they finally started Pitocin around 12 or 12:30, and then every 30 minutes they would come back in and increase the Pitocin. And so from 12:30 all the way to 7 in the morning, they did that. So we went through the night. We tried to get some sleep, but that was really hard to do. By 7 in the morning, that's when she went into active labor.
I remember it was at 19. Like, the level was
19 milliliters.
Yes.
Yeah.
And I think I started to feel contractions around like 17, and was thinking, okay, they're not going to increase it any more than this. So I already feel it. And they continue to increase it until, sounds like 7 a.m.
Yeah, it was at 7 a.m. and they kept it there. They kept it at 19. And when I started counting like the 5 minutes, 1 minute long contractions, and then it was getting closer, 3 minutes, 1 minute long contractions, I called Shalin, said, Shalin, it's
like we're
go
in
time.
active labor.
Yay!
And Shaylin's on FaceTime on my laptop in the room. And she's coaching me through everything because Brooklyn's doing her thing, and I'm like, what do I do? And I'm like trying to remember everything I learned in the last 6 months. Like from there, like, so she gave birth at 10:15 a.m. or 10:11 a.m. And I think from 7 to 10:11, like, it was really cool just to have Shalin in my ear, like, hey, Quang, you should help, like, remember, give her water, like, after every contraction. Water, do you want water? Do you want some coconut water? Do you need something to eat? And then she goes through the contraction again. I think there was a point where Brooklyn was like, I don't know if I can do this. Like,
oh, yeah. There was a point where I said, I need some relief. And the midwife that was there, she knew that I did not want medication.
Jessica.
And so, Jessica, yes, she knew I didn't want medication. And so she was like, okay, let's get you into a bathtub. And there wasn't a bathtub in that room, so we had to walk into another room. But that for her signaled, like, let's do something different.
Not necessarily let's get an epidural, but let's do the next, comfort measure that you need.
yes.
That was your wish. Okay.
Yeah.
Yeah.
So you did get in the tub? You were able to get in the tub?
Yeah, for about 20 minutes. But I was strapped with the monitor for the baby's heart rate, and they, underwater, like, it was just moving around too much, and so they couldn't monitor her anymore, and so I had to get out. Mm-hmm. So I think I was in there for about 20 minutes. But then by the time I got out, they looked at the water and they said, and then, like, I had membranes hanging from me, and so they were like, oh, baby's coming. And so Jessica checked, and baby's head was there. So as soon as I got out of the tub, like, baby had already dropped and crowned, or I was...
Yeah, so you saying, I need relief, I'm not sure I can do this, was basically transition, and then you were able to spend transition in the tub, and then you got out and baby was coming.
Yes. Yeah.
Yeah. There was a moment before that was pretty funny. It was just me and Brooklyn in the room, because so the nurse, Kristen, who was awesome, and Jessica, the midwife, who's also awesome, they both had to tend to, like, other patients in the hospital. And so there was, like, a moment, like, around, like, 8 o'clock where it was just me and Brooklyn and Shalin in the room. And Brooklyn was going through, like, a really intense wave. And she, like, after the wave was over, she literally said, I think the baby's coming. I think the baby's coming. And Shalin was like, Wayne, Brooklyn says the baby's coming. go into the hallway and tell somebody the baby's coming. And so, because I was like, I don't know what to do. Like, is the baby coming or not? Is she just going through another intense way? And I'm like, okay, Shalin, I'll listen. Like, this is what you would do, and this is what you're telling me to do. I'm gonna go do it. So I run into the hallway. It's like a quiet hallway, and there's like a bunch of nurses at the nurses station. I was like, excuse me, I think the baby's coming. And they're like, okay, we'll send somebody in, thank you. And so like I run back in, I'm like, okay, someone's coming. And like that's kind of when they started getting the tub ready for her, and we were able to get into the other room where the tub was, because in the room we were at, there was no tub, so we had to switch rooms kind of mid through everything. But yeah, otherwise I was just sat in the room. Yeah, because I mean, how do you talk to nurses in like, you know, in like a really quiet hallway? Like, I don't want to sound like I'm, you know,
needy.
Yeah, or like, you know,
help. Yeah. I love it. So, and I wonder too if they were surprised it happened so quickly, because you said your contractions didn't really start till around 7, and the baby came at 10. That's pretty fast for an induction for a first time parent.
Yes. Yeah. I don't think anybody anticipated it being that fast. I think I remember them saying that it was like, this was really quick. Because when I got out of the tub, they were shocked that like that there were membranes like hanging from me. They're like, oh, there's a head. Okay.
And
he's here.
I remember, I was just standing on like, well, I don't know, there was a couple people in the room. I just didn't want to be in their way, so I was just standing. I was holding Brooklyn's hand, actually. That's what I was doing. So I was holding her hands, and Shalin was still, like, we brought the laptop over, and Shalin was still there with us. And Jessica, our midwife, was like, baby's coming, head is crowning. Do you want to see? And I was like, sure, I'll come over and look. And I was like, sure enough, there's a head with a bunch of hair. So I like am holding her hands, and Shalin was like, hey, Hoang, did you want to go catch the baby? And in my mind, I wasn't even, so we had planned on doing, like, I wanted to catch the baby. Like, I talked to Shalin about it. We practiced with Shalin, and she told me how it would go, and this is how you would do it. So I had, like, practiced everything already with Shalin. But in my mind, I was like, we've been in the hospital for almost 24 hours. I just want the baby to come out safely. Like, I don't want to catch the baby. Like, I'm fine with just the baby coming out, and I'll be really happy. But Shalin was the one who reminded me. She was like, hey, I know you wanted to catch the baby. Do you still want to catch the baby? And Brooklyn's, like, head was down at this point like this, and she's still holding my hands, and she was just like this, like, go catch the baby.
I motioned him away.
And I was like, okay, I'm going to catch the baby. So I walk around to the other side, and, you know, if it wasn't for Shalin reminding me that that's what I wanted to do, I wouldn't have asked Brooklyn, because I didn't want to bother her. And in my mind, I was just thinking, you know, all I want to do is just have the baby come out safely.
But Shalin knew you didn't really want to miss that opportunity.
Yeah. So she was like, do you want to go catch the baby? And I'm really glad that she said that, because it was such a beautiful experience just being able to hold the baby for the first time. But yeah, so.
And passed her to me.
And passed her to Brooklyn. So I went and caught the baby. Brooklyn gave birth on hands and knees, and I caught the head and turned her around. Like, Jessica, the midwife, was just supporting me the whole time. I was like, good, perfect. Like, and then turned the baby, and I turned her and handed her to Brooklyn, and that's it. That's what happened.
It's amazing. What made it feel so powerful and miraculous to both of you?
Wow.
I can say it. You want me to go? Or do you want to go?
Are you ready?
I'm ready. I know exactly what was wrong.
Okay, I need some thinking time.
Okay.
Yeah, go for it.
So, like, there was a point when I literally thought my eardrums were going to blow. Like, I literally thought, like, I was like, this is the loudest I've ever heard anybody, ever. Like, Shalin described it as a roar, and how, like, in the background, as Brooklyn was going through her contractions, I heard Shalin say, wow, that was so powerful. Oh my gosh, like, what a powerful way to bring your baby into this world. Like, and I remember just, like, the word power kept sticking in my mind every single time Brooklyn went through a contraction. Because I was just thinking, like, it takes a very powerful woman to go through this experience. Like, I could never, like, I don't even know what I just know that my hands are about to break and my eardrums are about to blow. Like, and I was just thinking, like, and, you know, the moment, like, I've never experienced anything like that ever before. Like, I felt so powerful because of how she was responding to each wave. And I remember just thinking, like, wow, like, this is the most beautiful, powerful moment I've ever experienced in my entire life. Never heard anybody this loud before. Like, it was like a lion's roar. Like, she was literally, she sings, so like it's like this beautiful noise of like, I don't know, opera level, like pitched like noise that was going throughout
opera
the whole
volume, opera level,
I
roaring.
was like, yo, this is so powerful. And like, again, that was reinforced by Shalin telling Brooklyn after each wave, she was like, wow, Brooklyn, so powerful. Like, keep going, you got this. And our nurse and our midwife would say the same thing. And I remember just thinking, like, yeah, this moment, if there was a word to describe what this is like and how this actually feels, this feels powerful. Yeah, like, that was what made it powerful for me, because I just remember watching you just like, again, like, no one's ever squeezed my hand that hard in my entire life. I was, as a young boy, I used to, like, you know, run across the street and my mom and dad would just like grab me and da-da-da. Like, but never have I ever had anybody squeeze my hand that hard, and never have had anybody ever like scream in my ear that hard. But like, I was right there next to her, and it was like, you know, yeah, it was so powerful. And by the time that, you know, the baby came out, I was like, wow, she did it. Like, she went through, I don't know, like everything that I saw her go through, right? Like the attempts to start contractions with breast pumping, the misoprostol, checking into the hospital at 2 p.m., the pricking to just get an IV started, the 7 hours of increasing Pitocin before she finally got into active labor, and then finally like going through active labor, you know, like that all played around in my mind. And I was just thinking, like, coming to this point of her in the final moments of her waves to be able to get our baby out, like, wow, like, that was powerful. Could I do that? I would never. She asked me after, she's like, would you ever want to go through that experience? I was like, no, I wouldn't. I would gladly take the other side again.
Do some role reversal.
Yeah.
Yeah, for me, I think the miraculous part is after all of the planning and all of the like decisions that we made together about the way that we wanted to like have our baby, like, one, it was so empowering for most of those things to remain true throughout. But I feel like the miraculous part is like the intuitiveness and like the spirit like just kickstarts. I feel like in labor, where all the planning, like those things help, but like there's a just like miraculous like way that your body responds and works as a woman, like without thinking. I was like completely surprised, shocked, proud of myself, and just how my body just responded and just was like ready, even though I was so exhausted, so worn out. Like, my body was ready. And to me, that like, I just think that is totally out of this world, like miraculous for like a woman's body to be ready to go through that, even after like being so exhausted and worn out and just tired. Like, yeah, there's something just miraculous, I think, about a woman's body that I felt like so grateful to experience. And I could do anything. Like, I could fly. There's nothing that I can't do anymore. Yeah.
How cool it is to start off parenthood with such a feeling of empowerment.
Yes, absolutely. Yeah. And I think like as a Black woman too, to start off, like there was something one of our midwives during the experience about like my identity as a Black woman. I think that my role in this country and in society is to, I'm off work, to make sure that I'm getting myself ready and like giving myself permission to do that. And I was not giving myself permission to do that because of like the identities that I hold as like an employee, as like a person that's working really hard for things like outside of like my family and my relationship. And she just encouraged me to take time off, and even the decision to say, like, work, I need you to press pause right now. I need to focus on my child and my family. Like, there were many steps that I feel like prepared me for the like empowerment of like going into labor and having a baby, and just being like a strong Black woman who feels like capable of doing all of these things, but like choosing what to prioritize and knowing that like my identities, I have choice. I'm important enough to like give myself permission to choose. So I feel like, yeah, going into motherhood, I'm starting with that mindset and feeling like unapologetic about it, which is awesome.
You were in control of all your decisions, like all along the way, and the care you received, what interventions you agreed to, all of that.
Yes.
So I want to make sure we have time to answer your questions because I know you two submitted some really good questions to me ahead of time. So what was your first question for me? How can I help you?
Yeah. So our first question is, how can we ensure women, particularly low-income Black and Indigenous women, gain access to high-quality prenatal care, like including the evidence-based birth courses and resources and doula services?
Yeah, I've thought about this a lot when I received your question. One thing that we've known for a long time is that we really desperately need more Black and Indigenous doulas and midwives and childbirth educators. They are currently very underrepresented in these professions, and there's a lot of reasons for that, primarily having to do with racism. And also, for many years, most doula trainings, childbirth educator trainings, and midwifery educational programs were and still are mostly run and directed and taught by white doulas, white childbirth educators, and white midwives. And this creates what we call racially discordant or non-congruent experiences for people who might want to go into those professions who are Black and Indigenous. Thankfully, there are now a variety of trainings that are becoming more and more available that are taught and led by Black and Indigenous birth workers. We've interviewed several founders on the podcast of people who are training doulas and midwives who are particularly leading like Black-led organizations. And I really see that as one of the big solutions because I think that we know that many Black families often feel more comfortable and have better experiences when they're taught by someone who looks like them and has had similar experiences as them in the healthcare system. So one of the things we've done for several years now at EBB is we've had scholarships and sliding scale fees in place to recruit more Black and brown birth workers into our instructor program so that we can have a thriving group of excellent Black and brown EBB instructors. And one of our primary goals for 2021 is to grow that group even more. And so growing the number of available EBB instructors who are Black, Hispanic, Asian, Indigenous, LGBTQ, is one of our top priorities here. But that's only like half of the issue. The other half of the equation has to do with funding. So I had a conversation with Dr. Saida Pepra, who's a consultant and a speaker and a psychologist and doula. And I've hired her to meet with me monthly to discuss anti-racism issues and to consult with me on that. So I actually brought your question to her. And she really thought that it all comes back to funding, that funders, donors, philanthropists need to fund scholarships or provide grants for these kinds of things, for Black and Indigenous families to have doula care, to have childbirth education. She suggested that they could, have partnerships with organizations that are providing these services. For example, if a Black or Indigenous-led group is able to be paid to doula these clients, or they're able to pay an EBB instructor who's Black or Latino or Indigenous to teach their clients. Because the EBB instructors, just like everyone else, they have to make a living and we can't expect them to work for free. And so the main cost of that would just be paying for their time to teach the classes. And Dr. Saida basically said, people with money need to pay for these things. Instructors need to be paid. These nonprofits that are on the ground need to be paid. And she said a couple million from one or two philanthropists would completely change the game, because how many parents and families could get childbirth education or doula services with that money? Wow. Or she said, think about, getting healthcare organizations to pay for it. What if insurance companies, what if hospitals were like, we're going to pay for these families who need it most to get this education or to get this doula support? So Absolutely. I think that's kind of the two halves of that equation. One is making sure we have representation in these fields and supporting the groups that are working on that are training Black and Indigenous and brown doulas and midwives and childbirth educators. And then also, pressing for more donors to fund the nonprofits on the ground. that are providing the services. So that was what my thoughts were on that question.
Thank you, Rebecca. Yeah, I'm hearing you say representation and funding are the two most biggest ways that we can have an impact. And my sister is a midwife too, and she became a midwife while I was pregnant. And she didn't live in the same city as me, but like the ability for me to call and ask her questions and like get her expertise as a Black woman like was invaluable. So yeah, we would hope that all like Black and Indigenous women and families have that access.
Exactly. What else did you want to talk about?
Yeah, the second question we had was, are there good examples of states that have policies that support outcomes that demonstrate having holistic care for women of color improve the birthing experience and healthy births?
Probably the most important study we have on this was published in 2018 by a team of experts, including Saraswati Vidam and others. And it was called the Access and Integration Maternity Care Mapping Study, which is kind of a long name, but the point of the study was to find out if integrating midwives into the maternity care system, which goes back to your conversation with that doctor, if that actually changes health outcomes. And so they were looking at integration of all types of midwives, including certified nurse midwives, and certified professional midwives. All of these midwives, what they have in common is that they all follow the midwives model of care, which is a holistic, family-centered model that has demonstrated excellent outcomes in every type of birth setting. So what this research team did is they had a huge interdisciplinary team that developed a scoring system which scores each state on criteria about their laws and regulations, whether or not their laws and regulations support midwifery care or limit midwifery, including the ability for midwives to prescribe medicine, how can families access midwifery, is it included in insurance coverage, and how is the ability to make smooth transfers to advanced medical care when needed? For example, if you're planning a home birth and you need to transfer to the hospital from a midwife to a doctor model. So this was the first research on this subject in the United States. They basically found that states that have higher midwifery integration scores, where there's better integration of midwives, were associated with improved outcomes for mothers and babies, even when taking into account the impact of race. So having increased access to midwifery care is linked with higher rates of breastfeeding, lower rates of medical interventions, higher rates of vaginal birth after cesarean, and importantly, lower rates of newborn death, including race-specific newborn death. They also looked specifically at race-specific pregnancy outcomes by the midwifery integration scores. And they found that, sadly, in states where more Black babies are born, think of the southeastern United States, integration of midwives is lower than where states where there's fewer Black babies are born, we have more access to midwifery care. Wow. And access to midwives and the density of midwives is just significantly lower in states where more Black babies are born. And the states with the most Black births have the highest rates of newborn death. But they found that New York State has a very high density of Black births, but they have one of the lowest rates of newborn death in the United States. And they have in the top quartile of scores for midwifery integration. So going back to your question, are there any examples of states that have good policies that impact care? New York State is a good example of a state that more so than most states has policies that support midwifery care, which is then associated with improved outcomes for families of color. In contrast, you can use like North Carolina, Alabama, and Mississippi as examples of states where there is a very high percentage of Black births, high rates of newborn death, and very, very low midwifery integration scores, where there's extremely low rates of midwives and midwives being integrated into the system. So basically, the research from this study, which was a very powerful study, shows that the higher score, the more the state integrates midwives, the fewer racially, health disparities we see. So I'll send you the link, but their website is called birthplacelab.org. And if you click on the maps tab, you can explore the maps, and there's like a tutorial on how to use the maps. So basically you can like make the maps different colors, and it'll show you how integrated the midwives are in the different states. And you can layer it by like different outcomes like cesarean rate or newborn death rate or breastfeeding rate. And you can kind of see how it all fits together.
Wow, that's incredible.
No, that's such good information.
Thank you for sharing that.
Yeah.
And it was birthplacelab.org.
Yeah, birthplacelab.org. And that's a research team that's been doing a lot of studies on not only midwifery integration, but also mistreatment in childbirth and other experiences of racism in childbirth and other things. So they're putting out a lot of fascinating research you can explore on their website.
So last question is, what is the research regarding partner support and healthy birthing outcomes?
So there is a lot of research on this showing that partner support improves outcomes both for the birthing people and babies and helps with having positive childbirth experiences. We have more than 26 randomized controlled trials that have tested the effects of having someone continuously stay with you during labor on more than 15,000 people who've given birth. And overall, people who receive support are more likely to have a vaginal birth. They're less likely to have pain medication. They're less likely to have negative feelings about their birth experience, and they're less likely to have cesareans. In addition, their labors are shorter and their babies are less likely to have complications. So this is why it's so important to have someone by your side all the time. And it was one reason it was so upsetting at the beginning of the pandemic to see hospitals just unilaterally say you can't have any support person, much less a doula, because it's a safety issue. Like your safety outcomes are going to be a lot worse without a partner. And the best results in the research occurs when you have a trained doula there as part of the team. And that is someone who's not a staff member at the hospital and not part of your social network. So when the hospital called you and was like, well, what can we do to kind of replace the doula? Like literally they can't. Like they can do their best to make it a better experience, but it's the doula's presence, the person who's not a staff member at the hospital, who makes the better outcomes. Does that make sense?
Yes.
And but we don't have any research on virtual doula support, at least not at the time we're recording this, but it was really cool to hear how like some of the things Shalin would have done in the room, like she was still kind of able to do over FaceTime, which I don't think it's a replacement for being in person, but it's definitely, it helps. Like it's better than nothing. That makes sense.
Yeah. I could say that her voice definitely helped.
Yeah, it sounds like she set the tone for the room. Like when she was giving you compliments and affirmations, like the rest of the team kind of was like, oh yeah, you're right.
Yeah.
Absolutely. Yes.
Yeah, she did. She certainly set the tone for the room.
Well, and that's the other thing too. We found another research study was sponsored by the World Health Organization, published just in 2020 by Baldi et al. And they were looking at around the world, does having a labor companion reduce the risk of mistreatment? And they found that having somebody there to support you, a companion, either your partner or somebody else, lowers your risk of all kinds of mistreatment. Sad to say, but there are countries around the world where physical abuse can happen in labor, like being beaten, slapped, kicked, or physically restrained. And so they found that you're less likely to experience physical abuse. You're less likely to have a non-consented vaginal exam. You're less likely to be ignored when you voice a concern. And you don't need as much medical pain relief because you have that companion with you. So I thought that was an interesting research study. And that was from low-income and middle-income countries. But I thought it was an important study, just having that third party kind of there as a witness of changes how people interact with you as the client, if that makes sense.
Yes. Yeah, absolutely.
Thank you so much, Rebecca.
Yeah, thank you, Hoang and Brooklyn. It was so wonderful getting to meet you and hearing your birth story. And we look forward to sharing your story with the world.
Yeah, if there's anything else that we can help with, we now see ourselves as like advocates and champions for EBB. Like, please don't hesitate to let us know. This has been such a transformational experience for us. So we are forever just grateful.
I know that you actually have been talking about online about your experience with doula support. Do you have a YouTube channel or Twitter or somewhere where people can follow to hear from you?
Yeah, we started one, and we have one video right now with the plans of making more. So our YouTube is
Learn, Love, Liberate.
We hope that it continues, but we'll definitely message you the link.
Well, there's at least one cool video on there, I know, because I watched it. So if anybody out there is listening and their partner is on the fence about hiring a doula, I think it would be a good video to show your partner.
Yeah, thank you. We're so happy you watched. That's awesome.
Yeah, we're planning to do more. I think in the video we mentioned making a video about midwives, but we have not done that yet. But I think our goal is to be able to spread this information because we found how useful it was for us. I think the question about funding was huge for us because we're thinking, how do we get access to these services and these resources to everybody? Our thinking was I think one thing you mentioned was having this being a part of your healthcare plan and your insurance plan is to be able to have them pay for a doula or have them pay for an evidence-based birth class. So we're thinking about, where is this going to take us next? And certainly think this journey has been sparked by a lot of what we've learned from you. So thank you so much.
That's so inspirational to hear that you want to, keep doing the work and keep advocating for other families. I would encourage you to visit our birth justice page at evidencebasedbirth.com/birthjustice. We have a list of national and local nonprofits that are led by Black, Brown, and Indigenous folks. And they're, the ones that if you're looking for and if you're able to find people who are interested in funding, I think I get frustrated and sad sometimes when I see people in the news talking about these big donations being given to these big organizations, but it's actually these small organizations that are on the ground that are literally saving lives, changing lives every day that need support, and they're not getting enough support from philanthropists. So if you can spread the awareness of those organizations, that would be super helpful.
Yes, thanks for letting us know about that. And thanks for all of the amazing work that you're doing. I feel like every time that you share something, it's just it resonates so much with what we think things need to, what we think needs to happen. So just again, thank you so much, Rebecca. It's been awesome talking to you.
You're welcome. This podcast episode was brought to you by the book Babies Are Not Pizzas, They're Born Not Delivered. Babies Are Not Pizzas is a memoir that tells the story of how I navigated a broken healthcare system and uncovered how I could still receive evidence-based care. In this book, you'll learn about the history of childbirth and midwifery, the evidence on a variety of birth topics, and how we can prevent preventable trauma in childbirth. Babies Are Not Pizzas is available on Amazon as a Kindle, paperback, hardcover, and Audible book. Get your copy today and make sure to email me after you read it to let me know your thoughts.